So when we think about diagnosing keratoconus, more advanced keratoconus isn't really difficult to diagnose because the patient has a whole bunch of different issues. They're not seeing the way that they should. They have high amounts of astigmatism. But the whole goal is catching keratoconus in the early phases. And that's where it can be challenging. That can be a real difficult piece. And so there's a lot of different things we have to look at. We need to look at their keratometry values, or what are their K values. If I see a K value of 47 or above, that's concerning to me, and I'm going to dig a little bit deeper. If I see thin corneas below 540 or so, I'm going to start digging a little deeper to make sure that there's not something abnormal going on. We run tomographies in our practice, especially when we're dealing with refractive surgery candidates, and we're looking for anything that's occurring with the posterior float on the tomography, corneal thinning on that tomography, and the shape of the cornea as well. If we see anything out of the ordinary that comes up on those particular instances, we're going to talk to the patient about a few different things. We're going to, number one, ask them, hey, are you an eye rubber? We want to know if they rub their eyes often, because eye rubbing is connected with keratoconus. We've seen it in multiple studies that we know a high percentage of patients with keratoconus rub their eyes. And then we're going to also talk to them a little bit about undergoing genetic testing with the Avellino test. If they're not necessarily diagnosed with keratoconus, we don't have keratoconus as a diagnosis on our tomography, we like to assess the risk of them potentially getting keratoconus, because it's going to really lead us down the pathway of what we can offer them for refractive surgery standpoints. If they come back with a low Avellino test, we're going to be more confident in moving forward with something. If they come out with a moderate one, we may be less confident. If they come back with a high, we may pause for a bit. And so Avellino really isn't diagnosing the keratoconus for us. It's really helping us to assess risk and allows us to have a very comprehensive conversation with our patient about what are the best options from a refractive surgery standpoint for that particular patient.